Okay, what is a virus? There are many biological agents living in our environment and also actually on us, on our body. Virus is a biological agent. They're very small, our eyes cannot see, so imagine our whole body will actually be a very huge planet for them, a whole new world. Now, not just virus, we have bacteria, we have fungus, we have virus, we have yeast all over our bodies. So bacteria, fungus, virus, yeast and all these, they are just like humans. Bacteria, fungus and yeast are alive. So they need to eat, they need to go to the toilet, and when they eat a lot of things, they also produce a lot of chemicals. And more importantly, they can produce their own babies, just like humans. Now, virus is a different story. Virus is also a biological agent, but it is not alive. It cannot eat, it cannot produce chemicals like bacteria, and it definitely cannot produce babies. So, virus needs a host to produce the next generation of babies. Animals can be hosts, insects can be hosts, humans can be hosts. So viruses are actually using us as factories to produce their babies.
So let's say that this guy has the flu, could be any flu, and here's a droplet from his sneeze containing, if we move in and take a really close look, you see each one of those little purple things is a virus. Here comes the virus, and it's going to land on one of this guy's throat cells. So notice it's covered with little yellow knobby things that you call these keys, right? If the keys on this virus happen to fit the locks, which are those little purpley hiccupy things on the surface of the cell, if there is a match, the cell, watch this, welcomes the virus in. Structure disperses, and the virus capsule bursts, and out comes the secret recipe for how to make more viruses. So it's a copying machine making copy. Here they come. This is an eruption of viruses. After only one virus entered the cell, but how many came out? Well, millions.
Now we know, in order for a virus to use our bodies as reproduction of babies produced in factories, they need a suitable key and lock combination. So, just like humans, we have many different types of keys. We have keys for our cars, for our house, for our offices, many different doors. So are viruses. Different viruses will have different keys on their bodies, and they attack hosts with these suitable doors only. Thus, some viruses can harm animals only, but not humans, because only these animals have the suitable doors and therefore they can enter, but humans don't. Some viruses can jump from animals to humans. Why? Well, since we don't have the doors anyway, so how can those viruses enter us? One good example is the H1N1 virus. It actually originated from swine, and it was detected in 1918. Viruses can mutate, and they can change, for example, changing their keys. Just like humans, if we cannot enter our office door one day, we will change our key and we can open the door. So once a virus mutates and change the key, they can enter our door. Sometimes a virus goes through different hosts, and along that processes, they change or mutate. As discussed in part 1, we learned that different viruses have different keys that can open different locks and different doors. Viruses are very small, so how small are viruses? They are so small that even bacteria cannot see them. And sometimes viruses also infect bacteria. So can you imagine how tiny they are? Now imagine if our whole body is a planet. So different parts are different countries. So different countries will ultimately have different locks and different doors. So different viruses will target different countries because they have different keys that can open only that part of the organ or that part of our body. Now, one good example is the influenza virus or flu virus. Flu comes from the word influenza, by the way. So influenza virus targets epithelial cells. So where do we have epithelial cells? We have a lot of epithelial cells on our respiratory tract. So that's why influenza targets this respiratory area. When viruses use our bodies to produce babies, our cells rupture, they die. That is why during an influenza attack, we develop very painful sore throat because they target our epithelial cells, and during the process, our epithelial cells get damaged. Let's look at HIV. Why is the HIV virus so deadly? HIV targets white blood cells. So HIV is actually using our white blood cells as factories to produce their babies. And what happens during that production? Our cells die, our cells get destroyed. Our white blood cells will actually get destroyed by HIV. So imagine, we have lesser white blood cells, and since this HIV is using white blood cells to replicate and produce their new babies, HIV increases. So the more they increase and the lesser our white blood cells are, we have actually a very imbalanced system. That is why most people that have HIV, they don't die because of HIV. They die because of other diseases or other invaders that actually attack the body and the body cannot fight. So now we know flu virus attack epithelial cells. HIV virus target our white blood cells. How about the novel coronavirus COVID-19? What is its target? Now, COVID-19 is a novel coronavirus. It's very new. We don't have much information, but based on current information, it is shown that COVID-19 actually targets one type of matter in our body. It's an enzyme. It's called angiotensin converting enzyme 2, or in short, ACE2. Where can we find ACE2? We can find ACE2 in many parts of our body, but ACE2 is also very abundant in lungs, heart, kidneys. These are also the organs that are damaged in not just infected patients, but also in aging or elderly people. As we age, our immune drops. So naturally, we have a lower immune system and defense. And if we look at our elderly, they would most probably have illnesses related to their lungs, to their heart, to their kidneys. So that is why elderly is very vulnerable for COVID-19. Not just that, people, normal younger patients, but if they have underlying diseases such as diabetes, hypertension, coronary heart diseases, they are also at higher risk for COVID-19's targets. When it comes to COVID-19, many people are hoping for a cure. And when the word cure pops up, people always think of a vaccine. In the case of COVID-19, a vaccine for cure is rather challenging. Let's see why. First, what is a vaccine? Let's say vaccine for flu virus. We are actually injecting the flu virus into our body. Many people do not realize that. So why are we not sick? Because the flu virus that we're injecting in are inactivated, very low concentrations, or they are not harmful in certain parts of the virus, such as its genetic materials. So when our immune system detects this inactivated, low-level, less harmful, or genetic material of the virus, they kill it. So the next time the same virus attacks us, our own immune cells will remember, and it will kill the virus very quickly. So we are protected. Vaccine needs a period of time to activate our body. Normally, for flu vaccine, for example, we need at least 2 weeks. So based on all these, there are several things that we should know. Number one, each one of us have very different immune systems. You and me will have very different immune systems. Even the number and the activity of our white blood cells are different. Now that's just between you and me. Even within myself, as I'm aging, as I'm getting older, the activity and the amount of our white blood cells will also decrease. Vaccine will not show the same efficacy for everyone. Number two, once a virus mutates and change, as what we've discussed in part 1, change its keys or genetic material, this vaccine is less effective. So that is why we need a flu vaccine once or twice each year, because the flu virus mutates very quickly. So the vaccine that we used the previous year, that we inject into ourselves the previous years, will be less effective for this year. For those that are familiar with a taxonomic tree, you can see many different branches branching out. So on a simpler note, let's look at the map. A different color indicates a different genetic pattern. We can see, for example, purple color from China. And when it comes to Malaysia, its blue color indicates a different variant of the virus already. And then when it goes to United States, as indicated by the red color, and to South America by the orangey yellow color, we can see that each time this virus goes somewhere, it changes. How can we develop a vaccine to keep on chasing this virus? Coronavirus is actually a group of viruses. It's not one virus. There is a committee, it's called International Committee on Taxonomy of Viruses, or ICTV, has listed the full genome sequence, or where the genetic materials of the virus information is known. And in that list, there are already 20 different species of coronavirus. Us humans, as different as we are and as diverse as we are, yet we are all the same one species. And everybody seems to think that this coronavirus comes from bats. Well, these 20 species, they come from exotic animals such as bats, alpaca, peafowl, and even whale. They also come from animals that are very close to us, such as domestic cat, dog, pig, chicken, cow, and different types of birds. Why are we not getting sick all the time? Well, because most of these coronavirus, these different species, they remain in animals. Of all the ones that we know so far, 8 infected humans. Out of these 8, 5 are less harmful, and they have been among us for some time. If we get it, if we get infected, we get a very mild flu, and we would most probably just dismiss it. The other 3 have caused high mortality rate in humans. The first was SARS, which happened in 2002 and which caused over 8,000 cases and over 700 deaths. Then came MERS in 2012, which caused over 2,000 cases and over 800 deaths. And then in 2019, last year, SARS-CoV-2, which we are experiencing now. So the concept of vaccine is rather challenging in this case of COVID-19, and only highly efficient if it fulfills 2 criteria. So first, imagine we have 4 variants of this virus 1, 2, 3, 4, all COVID-19, but they have different genetic makeup at this region. But they have the same genetic makeup, let's say, at this region. We have to find this region and build a vaccine. So, of course, we hope that the 5th one that comes will not change at this region. If not, the vaccine will be less effective. Number 2, as in all viruses, after a while, the virus will slow down, calm down, becomes more stable because they become more familiar with the new host. Just like human beings. When we move into a new house in a particular area, we are a little bit nervous, maybe a little bit aggressive. But if within the same area we keep on moving houses, we become more familiar with the surrounding, more familiar with the houses there. We become more calm, we become less aggressive. It's the same with the virus. So we have to wait for the virus to come down. It may take some time, and then the next vaccine that targets the latest calm down virus will be more effective. We want to change the door that the virus is entering, so that we change the door, the virus using its keys cannot open the door. If we can find a chemical or a drug that can block this door, the virus cannot enter. China released the model of ACE2. Remember ACE2? We talked about ACE2 in part 2. Now we know the model, we know the mold. So If a chemical can fit this door, it blocks the door for the entry of the virus. Some preliminary data is also reporting that COVID-19 may target our immune cells. This immune cell is called natural killer cells or NK cells. It is well known that not only the number, but the activity of NK cells decreases as we age. Now let's see the fertility rate based on age. Now, age 0 to 9, there's zero fertility. While fertility increases with age, global efforts are also targeting the strategy of blocking the door of NK cells. So from all these, we can see, traditionally, when we talk about virus, we think of a vaccine as cure. Now, we see it from a very different perspective because we know now a different enemy would need a different strategy. And in terms of COVID-19, other non-vaccine strategies may be more feasible. Virus can be deactivated in many ways. We can use UV light, we can use very strong chemicals like acids, or even very strong chemicals like chlorines. They can deactivate the virus, but they can also be very harmful to our bodies. These are actually meant as deactivation strategies for viruses on the surface. That's why we can spray very high concentration of chlorine on surfaces to deactivate the virus, but we don't put them on our skin. But please, don't pour those on our bodies, and please don't expose yourself to unnecessary high levels of UV rays. So for our skin, such as hands and so on, what do we use? We can also use chemicals. We can also use disinfectants such as alcohol-based ones with a minimum concentration of 70% alcohol. Alcohol can actually deactivate virus via several ways. One way is that it can actually stick to the virus, envelop it, bind it, so that the outer layer of the virus is enveloped in a layer. It cannot stick to us. The second way is alcohol can actually dissolve the outer layer of these viruses. Viruses have an outer layer to protect themselves. So alcohol dissolves this outer layer and thus the virus is deactivated. If we don't have a fever, we don't have to quarantine anymore. We can stop quarantine and go out. Please, don't. Why did China have a lockdown in the city of Wuhan? This is a very good example. Is everyone in Wuhan infected and confirmed positive? No, it is merely a confinement strategy.
A new coronavirus that has spread to more than 2,000 people is infectious in its incubation period, before symptoms show, making it harder to contain, Chinese officials say.
So most viruses will remain in our bodies very quietly because they need our cells and they need our bodies as production factories, remember, to produce their babies, as per part 1. During this time, we will not feel sick or we will not have any symptoms, but we may harbor the virus already. It is already in our body. Current statistics are also showing that there are indeed people who had COVID-19 but did not show any symptoms, which is 30%, quite a bit, while 56% show mild to moderate symptoms. If we continue to go out, we are going to infect everyone that we get in contact with. It is our responsibility to contain the spread of the virus. So virus is not alive. Antibiotics cannot kill virus. We don't consume antibiotics to kill virus. We consume antibiotics to kill bacteria. So if antibiotics cannot kill viruses, how do we get rid of it? Our own body's immune system will kill the virus. So our white blood cells would actually detect these invaders and eat them. Okay, the next myth, and I think it is one of the more interesting one. We must buy and stock toilet rolls or toilet papers. We do see such panic buying of toilet rolls across the globe. From a family in Australia who have accidentally bought toilet roll supply that can last them for 12 years, to an armed gang robbery stealing 600 rolls worth around Hong Kong dollar 1,000 in Mong Kok, Hong Kong, to a store owner in Japan that wrote curses on toilet rolls in its shop's washroom to prevent toilet rolls theft, to the panic in Taiwan when rumors spread that toilet papers were used to make masks and thus will have a shortage until the Taiwan government intervened. Why toilet paper? Well, again, from past human experience, some viruses, such as rotavirus, can cause diarrhea, and you would be needing a lot of toilet papers or tissues.
Today we know that the three main killers are pneumonia on one hand, malaria on other, but obviously diarrhea is one of the main killers today still, and specifically in developing countries. Acute diarrhea accounts to almost 11% of the deaths that we're having worldwide. And today we know that rotavirus is the main agent that causes severe gastroenteritis.
In the case of coronavirus, COVID-19, it doesn't cause diarrhea. It does in certain people, but majority that's not its primary symptom. So there is no such need to stock up tissue paper, toilet rolls. There are many more myths. Even WHO have listed some on its website. I'll include the link. And there's so much paranoia going on, it's good that we can actually look at those.